World Health Organization says Zika is, quote, spreading explosively. So how concerned are people in Africa over Zika?
Because we have already Ebola, which is against us, and if we add in Zika, it will worsen everything.
Few people know about it, and we don't know whether it's controllable, we don't know whether it's curable, we don't know how it spreads, so definitely I should be scared about it.
So far, Cape Verde is the worst affected, with a local outbreak.
In Africa, there is one country that has been affected and reporting, and that's Cape Verde, off West Africa, an island country, where quite a number, over 10,000 cases were reported, but currently between October and January.
South Africa, too, has recorded one case, a South American businessman.
The red is very high risk. Moderate risk is the yellow, and the least is low risk is the green.
The mosquito that transmits the Zika virus can be found across the continent, and the South African case highlights the potential threat posed by travelers.
The world is now a global village because of the modern means of transportation. One infected person coming to your country, and then that mosquito biting that person, and then that's it. After that, the cycle continues if that mosquito survives.
Along the edges of Lake Victoria.
But other experts disagree with the World Health Organization's risk assessment.
Here in Africa, the strain we have is not it does not multiply as much in the human body as that one which is in South America. Secondly, while we have the mosquitoes which may be able to transmit, most of the mosquitoes which are known to transmit are in the forests. And in the forests, they bite at night, at dusk, and at dawn, and over the night, when people are not in the forest. So the chances that anybody will get into the forest at night and be bitten are few.
The key to reducing the risk is vigilance, and that starts at home.
There are two kinds of solutions that have got to be done. One, sanitation in homes, to make sure that the breeding places where these mosquitoes can breed from are reduced as much as possible. The other thing, of course, is the production of the vaccine. At the moment, there is no vaccine, and no vaccine is expected until after 1 year.
The Ebola outbreak highlighted that several countries on the continent do not have the capacity to effectively deal with outbreaks, so preventative measures remain essential to ensure Zika doesn't spread into the continent. Zhang Cheng, CCTV.